My name's Nick Smith, and we're in KORT Physical Therapy in Corydon, Indiana with my daughter Trinity and my wife Kimberly. So over a year ago, Trinity was an athlete. She had done gymnastics since she was a small child, cheerleading, competitive cheer, along with softball and some other sports. So during softball, she started having issues with her shoulder coming out of socket and dislocating. We came here after some emergency room visits and got a lot of help from KORT Physical Therapy and Ashley. We went to Cincinnati and we were sent there by KORT Physical Therapy to see Dr. Favorito, who's a surgeon. And after reading the MRIs, he explained to us that there's not actually a physical problem with her shoulder that a surgery could correct, that it was a connection between the brain and the muscle that supports motion. And because of the way hers was working, the shoulder would come out of socket because it was unstable. So he told us there's a product out there that's specifically made and is working in patients through clinical trials in America, but not approved by the FDA, called the Shoulder Pacemaker. He thought that would be a perfect fit for her and the symptoms that she presents, but unfortunately it wasn't approved by the FDA. Ashley worked with us on a regular basis to try to contact companies, find places that were doing clinical trials, and it just didn't work out. No one was close. So it was for Ashley and us, it was a pretty emotional thing. Trinity, I got a call from the school. Her shoulder had come out of socket again. She couldn't get it back in on her own. This is becoming a more regular thing to where she just can't get it in. It's so unstable when it goes out, it's just not fixable by herself. So I brought her to physical therapy. An hour to an hour and a half later, 3 physical therapists are trying to put her shoulder back in, and they're getting not very far with it. And she's in pain. I can tell they're visually upset because here's this child with a shoulder that's not in place. They're trying to do it, and it's so bad, it's so unstable. When they get it back in, it's not staying in, so they're holding on to it. So I got hold of Mr. Winslow. The first shipment of the shoulder pacemaker had arrived from Italy into the United States, now approved by the FDA. They were in Indianapolis, and he got a hold of Craig, and Craig from Shoulder Pacemaker at 9 a.m. met us at KORT Physical Therapy in Corydon the next morning. After a year of nothing working, we're still pretty skeptical. Craig puts the device on her, shows us how it's going to work. Ashley and the other physical therapists are here, and he asks her to move her arm in a position that for a year she hasn't been able to. And if she tried that without the pacemaker, it would have went out of socket. So not only I think all of KORT was very anxious when she started to lift her arm with this pacemaker, thinking, there it goes, it's going to go out, and it didn't. She lifted. Before they attached that, I mean, she couldn't move her arm about 30 degrees this way or that way. And it started with sports, but it progressively got worse to where you can't use a pencil at a desk. She would have to put her notepad on her lap and do her homework down here. So when Craig says, okay, I'm gonna have you lift your arm up like this, we're all thinking, I hope this thing works. And it did. And she had said, it feels like a robot's moving my arm, because muscles are engaging that the brain's not normally asking to engage for this issue that she has. And 3 days a week for a couple weeks, we came in here, a half an hour to 40 minutes worth of work with the pacemaker, the program, and the things that they have written the program to do. She now has what looks like full motion without the pacemaker. And this is what changed the game for Trinity. So just wearing this for about a half an hour to 40 minutes, within 6 to 12 weeks, she's probably going to have a fully functional, normal shoulder with no issues, and will be able to return back to sports. And again, shocking, not only is she wearing this device and lifting her arm, which she hasn't been able to do, he says, well, you're only going to have to wear this a half an hour to 40 minutes, go through some exercises 3 times a week, and 6 weeks to 12 weeks later, it's going to be fully functional, and should be, or at least we hope, fully functional. It's almost unbelievable. Since day one, we haven't had a dislocation, and we had them every day. So this device helped our daughter. KORT Physical Therapy got this in her hands, and they didn't stop. Even when they couldn't fix it, KORT and Ashley went above and beyond by sending us to specialists and working with us. So this is the good thing, and it's a good place.
So
but to now know that she's going to be able to return to sports without any problems. There's no physical damage to her shoulder. It's working like it should. The brain's reconnecting. That's a full, happy life of doing everything you want to do, and you're not bound by a shoulder problem, an instability. So she's excited. She already wants to go back to sports. We need to be careful and patient, and I think she does as well. But the shoulder pacemaker definitely has fixed the problem she had. And if it wasn't for KORT Physical Therapy and Ashley, we wouldn't have got here. This wouldn't be in our hand. So pretty amazing. As a parent, when your daughter's hurting that bad and you can't do anything, you want to fix it. And when you can't, it's pretty tough. So to know that she's okay and she can throw a ball again, she can swing a bat, she can do a back handspring or whatever it is she chooses to do in the future, or throw a bouquet 20 years from now. I think we would recommend KORT Physical Therapy because even if it's a minor injury or anything you're going through, they care enough to go through it with you. Again, to have a physical therapist in the middle of the night come to your home to fix your daughter there's nobody that does that. This isn't 1920. Doctors don't make house calls. And when your physical therapist does, it's because they care. Not only do they care and they want to support you, they're working hard. They're calling other people. They're talking with specialists in areas that nobody does. I mean, we went to Cincinnati to see a shoulder specialist that none of the doctors around here, none of the normal doctors we had been to even knew existed. And this was the perfect person to recommend this product that wasn't FDA approved. It wasn't in the country. Nobody was using it. If it wasn't for KORT, we would have never known. It was their determination and their support that got us here.